With the Omicron variant surging across Canada, some provinces have changed the way they're reporting hospitalizations. But as Sean Previl explains, doctors are cautioning how people should interpret those numbers.
It's sometimes known as incidental COVID, when a patient is admitted to hospital for another reason but tests positive for COVID-19 during screening. More jurisdictions are reporting this type of admission, with some provincial health officials arguing it gives a better view of what's happening in hospitals.
While this is helpful information, it does nothing to really inform the conversation that your healthcare system, regardless of where you are in the country, is strained. It really is stretched.
Dr. Isaac Bogosh says the key point is there are many people in hospital and considerable staffing shortages. The numbers vary from province to province, with some seeing incidental COVID making up half of admissions, though the gap in ICUs can be wider. Bogosh adds incidental COVID can be difficult to identify because some patients may be admitted for something else like emphysema, but it was potentially made worse or even caused by COVID. And some may even acquire the virus while in hospital. Dr. Jesse Pappenberg at Montreal Children's Hospital says even if someone is asymptomatic, it can still have an effect on how staff respond.
Any COVID-19 patient can require enhanced infection control measures, which are an additional burden on our already overstretched healthcare teams.
There has also been concern whether releasing the data publicly is helpful. Dr. Nathan Stahl of Toronto's Mount Sinai Hospital says some people could use the numbers to downplay the severity of the virus.
It can be weaponized. The data can be weaponized in so many ways that downplays a real difficulty and human tragedy for so many people across this country.
Federal health officials say regardless of why a patient is admitted, the focus should be on reducing the overall burden on the healthcare system. Sean Previl, Global News.